So there are two ways that you can create communication notes. And one way is to be in a patient's chart when you create that note, and it will pull over diagnostic information automatically as well as the patient's name. Or you don't have to be in the patient's chart. You can actually be in your hotbox and create a communication notes that you're going to send to QA about the patient's condition. So I'm already in Erica Campbell, my patient's chart. So when I click on File and then New, and I select Communication, it's going to pull my patient's information automatically, the current date, their physician that's responsible for the plan of care, as well as the primary and diagnostic information and secondary diagnostic information with my patient's name and their main telephone number. And I can click on a drop down that has been created for me by my agency, a communication template. I can choose the appropriate one and make my changes. I can drag this area here, I'll drag it down and expand it a bit. This doesn't work on Apple devices or iPad, rather. It works on a Apple desktop just fine. If I want to remove and delete this information, I could just customize it however I need to and then chart accordingly. Once I'm done completing that entire note as designed, I'm just going to click on Add Communication. And here's where I have a few options. In the upper left-hand corner, underneath the patient's name, you will see an area where you can show and hide groups or show and hide your address book. In other words, I can send this communication as a K-mail to additional individuals within my agency. And by clicking on show and hide groups, because I've already created a group, I can send this to all of the nurses, all of the QA managers at once. I can just hover my mouse over that area and see which ones are going to receive the K-mail, just in case I forget, because I'm working between several branches, for example. And if I click one by accident, I can just deselect. If I'd like to just send out to individuals and not by a recipient group, then I can just click on Show and Hide Address Book. Now, when you click on Show and Hide Address Book, members of the care team will already be selected. In other words, individuals that have visits already assigned to them. If you do not want that individual who's part of the care team, whether it's the clinical care manager, QA manager, and this is the clinician that's seeing about her care, you can certainly deselect those as well. And it's going to send this communication note as a K-mail as soon as it has been QA'd. So we're going to just type in the date. And I'm not having to use the slashes here. I'm just typing in the numbers based on a naming convention and then clicking on Submit after electronically signing it. And that is creating a communication note when you want to record the condition of the patient. And that communication note is going to appear in the patient's chart in the Communications tab. So if I go to My Patients, pull up Erica's chart, go to the Communications tab, I won't see it here. The reason being is because I was in a specific episode when I created that communication note. And I was in episode, her very first episode, so that's where it's going to appear. So let's go scroll back and find it. So I'm gonna go back, That's the episode I had open. And if I scroll down, I will see that note here within this original episode that I had open.